So how's it been, sir, since March, since the lockdown and the pandemic, and all? Has it affected um, the issues that you deal with on a daily basis?
Oh, sure, it has. It's been a learning period for all of us. Initially we had actually to stop treatment of fertility cases because we did not know
Okay.
exactly how COVID will affect what we're doing. But after a while, we were also instructed to start treatment again. So yeah, but of course, we know that the whole economy is affected even by the pandemic. So it's everywhere.
But is there a way COVID-19 can affect infertility? Is there any link?
Well, like I said, initially it was from fear. We did not
Okay.
understand whether it was going to affect or not. But later on, we became more comfortable with it. Though a few weeks ago, there was also the report that, okay, fine, they've been able to see that COVID-19 could cross to the unborn child, you know, but we're not too sure how common that is. So everybody is still being careful. This problem is just with us for about 6 months in the world. So we're
Okay.
learning every day about it.
Okay. So what are the strategies in place to, help get more clients in this harsh economy as it is?
Well, yes, that's where we really need to be ingenious, every one of us. And what we've tried to do in my place is that we came up with a plan where it's possible for people to pay instrumentally for treatment. Okay, what we call the flex pay, where you can, for over 1 year, pay for your treatment. And if there are fluctuations in the prices, it will not affect you. So there is that kind of program that we have in place because we know that because the economy is shrinking, some people are bound to lose their jobs. Some people's earning income will definitely decrease. And so we need to also be able to place ourselves in such a place that they will be able to still be able to sort of afford our treatments.
Okay, sir. How has the option of IVF, has it what's the state of affairs on that, sir?
Well, I guess what I say about IVF is that, for those of us who have been in it for quite a while, the story is that today is better than yesterday,
Okay.
Yeah, because the awareness is getting much more than what we were a few years ago. And the stigma is reducing, and people are getting to accept more and more that IVF babies are normal babies. So I think
Okay.
it's great. It's great.
Then talking about infertility, sir, at what stage would you say we're at now? If you look back at where we're coming from.
Well, yes, thank you. If we look at it from the point of view of awareness, I think we're probably mid-stage. Okay, if you say 1 to 5, we're probably 2 or 3 in terms of awareness. But in terms of access, we're probably still at 1. Okay, because the number of people that need the service in Nigeria, for example, compared to the number of cycles that we're doing all over the country, is still very little because access is still an issue. Cost is an issue that many people still have to battle with. So yeah, if you look at from awareness has probably overtaken access.
Okay, sir. When we talk about issues like surrogacy and a few other I don't know what to call them now, options available, are they fallouts from IVF, or are they new discoveries, or how do we place all of those?
Thank you. Actually, they are fallout from IVF.
Okay.
Yeah, when, necessity, they say, is the mother of invention. We were able to cross the bridge of uh, IVF started with women, that
Yes.
when the tubes are blocked, then we could do IVF. But now we extended it to men. When your sperm count is not good, we could do IVF. And now also, then it got to people, okay, who cannot bear the kids on their own. They come for whatever reason, medical reason, social reason, they cannot carry the pregnancy on their own. And that's where surrogacy came in. And so it's an offshoot of IVF. And right now, actually, the more practiced kind of surrogacy is gestational or IVF surrogacy. So most of the time now, nobody does IUI, except most of the time when they do it, they are doing it even at home abroad, where you can get sperm, you can inject, you can do it yourself. Yeah, but most of these things that we see is IVF surrogacy, because there's less controversy from that, in the sense that in IVF surrogacy, what we try to do is that we don't use the eggs of the carrier, so that the carrier is not related genetically to the baby, because that was one of the problems that arose from the first case that they went to court about the popular baby M, who they went to court and said the surrogate said she was attached to the baby and did not want to leave the baby. So in order to forestall such, what we do is that we rather have not use the surrogate's eggs, so that there is no genetic linkage between the two of them.
Okay, I'd like you to also talk about the role of men in all of this. I know that increasingly there's been the male content of it. What should we know, sir?
Well, thank you so much. This is actually $1 million question, in the sense that on day in, day out, that's the question that most of us ask. Because this is what I mean. Men contribute equally to infertility as like women. But when you are doing IVF, the concentration is only on the women. All right? They take the drugs, when they're pregnant, they carry the pregnancy. Even when it's low sperm count, it's the woman that you're going to treat most of the time, in order for her to be able to carry the baby or babies. Now, but that is one part. The man is ignored. But also one part where I get very worried is that the psychological impact on the man also most of the time is ignored. And men don't help matters by trying to be macho sometimes, but the truth is that they feel the pain as much as the women. And that is one of the things I get to discuss with some of my patients sometimes, when they come in and tell me that the husband is not supportive. Yes, I know there's some men who are not particularly supportive, but majority of the men support. But sometimes the way they do this is different from the way the woman does this. And sometimes they cannot communicate well enough. The reaction of a man to stress is different from the reaction of a woman to stress. Okay, especially when the cycle fails. The woman cries and cries and cries, and she gets better. The man tries to console her, which is good, but he represses most of his feelings, and nobody actually attends to his feelings. And that's one thing I'm trying to work on now, that look, we need to get this men. In the first place, we need to get them to talk about how we can help them. And then we can see how we can, because you hear on a daily basis how some men misbehave in apostrophe open and close. But I know, yes, I know it's not that they want to misbehave, it's because they don't know how to deal with this stress. Because infertility is one of the most stressful things you will ever encounter as a couple. So and most of the things that we do, the women tend to get the support more than the men. So men really need to talk more, and let us be able to help them. Because most of the time when you say, oh, you need to go for counseling, the counselor wants to see you, most of the time the man says, no, I can handle myself. And I know it's not true, So I think we also need to lower this macho line and be able to get help sometimes. And sometimes the help they get is now inappropriate help. They're talking to people who have never been through this. They're talking to people who are going to advise them wrongly. And so it's I think it's just something, is a very big line that we need to attend more to, the men.
Sir, there are those who also complain that the problem they have with IVF is that you need to do it a lot of times before you get lucky as it is. So how come it's still not it's still a 50-50 chance most times when it's done?
I wish it was even 50-50, because it's about 40-60.
40-60.
And that's one, yeah, and that's what we talk about all the time, that you need to understand what the technology can do and what it cannot do.
Okay.
IVF now is not place the baby somewhere that you go and pluck the baby. Okay. What people don't understand is that when a man and a woman decide to have a child, when there is no problem at all, you know, how long does it take them to be able to conceive? And let's look at it this way. If you have about 100 couples who decide that they want to have children, in 1 month, only about 20-25% of them will be able to achieve it. That is what nature offers. And what IVF does is to replicate nature when there is a problem. So the success rate of IVF is in the neighborhood of about 40%. That's why I said 40-60 in the best cases, you know, per cycle. And that's why most of the time, when we want to counsel patients, we tell them that, look, it's better you prepare. Even the World Health Organization says that. It's better you prepare for more than one cycle. It says if you are less than 35, prepare for 2 cycles. If you are more than 35, prepare for 3 cycles. Because success rate in IVF is cumulative.
What does that mean, sir? The last sentence you made, is
yeah,
cumulative.
I said it's so if you do 3 cycles, you are likely, it's about 75% that you take a baby home.
Okay.
And what I tell patients again is that positive pregnancy test is not what we're looking for in IVF. What we're looking for is that you carry a baby home.
Then, sir, I was also going to ask, how do you also respond to the increased interest in women who go for sperm bank? I mean, as in keeping placing their, I don't know what is involved, but I know that a lot of people talk about it these days. How do you respond to that?
I guess it's great. It's part of the awareness that people like you are doing. Look, one thing that we're seeing is that sperm count seems to be going south all over the world. It's declining, and so it's good if you can store sperm. Yeah. Then there's some people, of course, because of the nature of their work, they probably need to store sperm. You know, in some countries, when you're a pilot, when you're in the military, when you have to store your sperm so that in case anything happens, you know. So, but of course, we're not caught up with that in Nigeria. But I think it's getting better by the day. Awareness is getting better. So I think it's a good thing that people are getting more aware of this kind of facilities. And yeah.
But so what are the other options? What are the other facilities available? We've mentioned just a few now.
Yeah. There's, you know, the good thing about what I'm happy about in Nigeria is that IVF is one of the fields of medicine where we can beat our chest and say we can contest with anybody anywhere in the world.
Okay.
And so the facilities, anything that you can get anywhere, it's available in Nigeria. You know, either by collaboration but you can get it done in Nigeria. You know, so so we can do egg freezing, and that's one thing actually that we think should be much more embraced than what it is now in Nigeria. Because, you know, somebody says it's actually a gift a father should give to his daughter when she turns 30 and she's not, there's nobody, no serious relationship in the horizon, you know, because we know that egg quality decreases with age. And the good thing about that is that if you store your eggs at 30, even when you turn to, when you're 40, the age of the eggs is like about 30. So you can always use your eggs, you know. So I think that that's one of the things that people really need to embrace in Nigeria. And I can tell you there's some centers that can do very well with this. It's not every center that can boast of egg freezing facilities, but there's some centers that can really do this stuff very well.